I was very pleased that the ministers took out of their very busy time to come and listen to us. The nurses are very pleased at this moment. We felt like we got across the message that we want to deliver.
Minister of Health Kevin Bernard spent 3 hours listening to the concerns of the nurses at the Southern Regional Hospital. When Bernard and his colleagues, Dr. Louis Zabane, Area Representative for Dangriga, and Rodwell Ferguson, Area Representative for Stan Creek West, emerged from inside the hospital, the Minister of Health had this to say.
As I mentioned to them, I'm here to listen. We're here to find solutions to the problems and set out timelines when we could address their concern. I think that the staff was very genuine. They were open and frank of many of the things that they feel need to be addressed. Many of these things, of course, some of them administratively, and others are infrastructure problems that we have to address. And I gave them my assurance that we're going to work on these things.
On Saturday, nurses at the hospital spoke out against the alleged ill treatment that they were experiencing at the hands of their administrative supervisor. This was one of the issues raised in today's meeting.
Some of the issues that was identified, that we have identified and the ministers have identified is that most of our issues were internal. So they have heard our complaint. We have write our petition against some people in administration, and we have requested new supervisors, or so we have made our petition, and they will look over it, and they will try to find personnel to come and take over whatever they need to do.
How did you take to the complaints they made so vexingly, which you found to be a surprise, against their administrative supervisor?
As I said to them, if that decision has to be made, then we will make that decision. If we have to make that change, then we will make that change in order to improve the condition, the working environment. At the end of the day, no one is indispensable, and we need to make sure that in every work environment, every workplace, if there's somebody that is creating more havoc for you, then that person has to go.
But administrative issues aren't the only challenges the Southern Regional Hospital is faced with. As Dr. Louis Zabane pointed out, the hospital is in great need of infrastructural upgrades.
We need to have the necessary investment to improve the facilities. This started way back, even before elections, in my experience working with the folks here, when we had the issue with the morgue. And we finally got that matter semi-addressed. It's still not properly addressed. So I am very, very grateful that Minister Bernard has come personally. But if you were to take a tour inside here, you would see that, in fact, we are probably one of the most needy institutions in the country.
What makes you say that?
Well, we've taken tours in there. You would see that many of the air conditioning units are not working. The rooms are needing to be upgraded, etc., right? So these are things now that we're addressing.
The protest that sparked a national movement on Monday, which led to several resolutions, and today's visit began here at the Southern Regional Hospital. The nurses at the Southern Regional Hospital says the message they sent on Saturday was clear.
We sent a clear message, and we had tremendous support from nurses all over the country. I had certain presidents, unions calling me and say, yes, we will stand with you guys. We are in full support, because this problem is not only Southern Regional Hospital, it's countrywide. Nurses are tired, we don't have supply resources, we don't have staff. So everybody was in support of our protests.
Reporting for News 5, I am Paul Lopez.